Like a lot of people, I've been hoping we could find a way forward and sort of stop the disruption and madness it's causing throughout the country. And I want to say to my colleagues who have been working together to find a solution to open up the government, I really appreciate your efforts very, very much. I know this polarized environment is hard to reach across the aisle, but this moment dictates that we try. I've had some discussions, and I know a lot of my colleagues have, Senator Britt and Collins and many others have spent a lot of time, Martin Wayne Mullen, trying to find common ground to open up the government so we can move forward and have a debate about health care and maybe find a solution. Apparently to no avail. There's a group of my Democratic colleagues who believe every day gets better for us. That's Senator Schumer. They, I guess, apparently feel emboldened by the election. The question I have for the country is every day getting better for you? If you're trying to get to an airport or fly somewhere, I would say not so much. If you're a government employee working, not getting paid, not so much. There are a lot of services that are being disrupted out there because the government shut down. And truth of the matter is both parties have had government shutdowns trying to get a policy win. You know, one time we shut the government down as Republicans to get money to build the wall. We eventually got money to build the wall because it was a very good idea, but it didn't happen through the shutdown. And so I learned that shutting the government down to try to get a policy win is probably not good government. And our Democratic friends, whatever day it is, they're shutting your government down, our government down, to try to make Republicans do something on health care we're just not going to do. They're trying to repeal elements of the working family tax cut, big beautiful bill, whatever you want to call it, that would prohibit health care funding going to illegal immigrants. They're trying to repeal many of the things that we think are just good reforms, over $1 trillion, pulling back $1.5 trillion to go in programs we think that are not good investments. Investing in a program where illegal immigrants can get free health care just gives you more illegal immigration. One of the things that we're trying to deal with is Medicaid has grown by 50% in the last 5 years, and we're trying to put it on a more sustainable path and helping rural hospitals. They want to take the provision out of the bill that would give $50 billion to rural hospitals to help with Medicaid reform. So we're just not going to do that. That's never going to happen, nor should it. So what do we do next? I think the first thing we need to do is understanding that the statement, every day gets better for us, is a lie. Us being the United States. Every day that this thing drags on is bad for America, it's dangerous for America, it's dangerous to our national security, the people in the FBI, the CIA that have to work no matter where they get paid, simply to protect our nation. So this madness really needs to end. I think there are plenty of people over here that would try to go forward to have a debate about health care and maybe find common ground, but not this way. The one thing I've learned in my time up here is that taking hostages, political hostage taking, shouldn't be overly rewarded. Political terrorism should never be rewarded. And what you're doing over there by not finding a way forward, you're terrorizing the country for your own political benefit. You really are engaging in political terrorism. You're making it hard for people to do things they need to do and have to do. You're making it hard for people to get services they need because your political desire to beat us. Well, I tell you what, that needs to stop. So to my leadership here, y'all have done a great job, Senator Thune particularly, kind of saying we'll talk, but we've got to open up the government first. I really appreciate what Senator Thune has done in that regard. But I want my colleagues to know the longer this goes and the more people you hurt and the more you try to extract from your political hostage taking, the less votes you're going to get from us, starting with me. I'm not going to give in to this. We're not going to reward people who do this. I understand trying to find common ground and getting something to give something, but you've gone way too far. You're hurting way too many people. You're asking for things that are really absurd. So don't think you're going to open up the government with a handful of Democratic votes if this continues. You're going to need much more than that, because you're going to lose me. I'm not going to play this game any longer. This is bad for the country, and if we do it now, it will never end. So Senator Schumer, I couldn't disagree with you more. Every day gets better for us. You clearly need to get out of Washington and talk to people outside the wacky left. You're disconnected with real life in America. Every day this goes on doesn't get better for us. What are you asking us to do? You're demanding that we increase spending by $1.5 trillion from savings we obtained from the Working Families Tax Cut bill. We're not going to do that. But the main thing that's driving this debate is a desire by Democrats to continue a program called Obamacare that is not well designed, that is costing way too much, it's not delivering for the American people, and we're not going to do that. Senator Welch, a good friend, noted yesterday that the Affordable Care Act hasn't lived up to that billing, and there are things we can do on health care to lower cost and make life more affordable. But my statement is that the Affordable Care Act is unaffordable, and we're not going to reauthorize it because you demand we do so, because it makes no sense to keep throwing good money into this program. Now, President Obama told us back in 2010, if we pass the Affordable Care Act, which is the Unaffordable Care Act, families would have a $2,500 a year decrease in their premiums for health care. Well, that's turned out to be a big flop. Health care premiums have gone up 100% from 2013 to 2019. So the Affordable Care Act is anything but. And they're asking for $350 billion over a decade to keep these subsidies in place that they chose to do in a partisan way. They're due to expire. If they were that great, why did you let them expire? The bottom line is you're trying to hold us hostage as Republicans, making us invest in a program that's just not a good deal for America. No matter what you call it or how you want to sell it, you're selling a bad product, and that product needs to be discontinued as it exists today. Who is the biggest winner of the Affordable Care Act? Not consumers, a dramatic increase in premiums. We didn't lower premiums by $2,500 per family. They've gone up by over 100% in just a matter of years. Now you're wanting to continue subsidies that create subsidies for the Obamacare that nobody in the private sector has. The average person in America is paying about 25% of their premium that works for a company. What they're trying to do is basically have most people pay nothing and allow people making up to hundreds of thousands of dollars to get subsidies for their health care. We just can't afford that. Senator Klobuchar talked about a husband and wife that retired early from a union job that have a combined income of about $130-something thousand, that their premiums will go up. Well, the question is, do we need to be subsidizing premiums for people that make $130-something thousand that have defined benefit plans plus Social Security? The question becomes, what makes sense? What can we afford? What's the best way to help the American people? I tell you, the best way to help the American people is stop the madness when it comes to Obamacare. What has happened since the passage of this bill? Let me tell you what's happened. Healthcare companies, insurance companies in the healthcare space have had their stock go up since 2010 by over 1,000%. Now, what you want us to do is continue these subsidies that go to insurance companies that drive up the cost of health care. We're not going to do it. we're going to try to find a better way to use the money to give it to consumers so they can buy health care of their own choosing, to create competition that doesn't exist, to get a better health care outcome and save some money in the process. So Democrats are insisting that Republicans continue the practice of taking your hard-earned tax dollars and making healthcare insurance companies incredibly filthy rich. Look at this chart. This is the S&P 500. These are different companies in the space. But the main healthcare companies that benefit from Obamacare have seen their stock increase by 1,000% with no end in sight. United Healthcare, 1,177% increase in stock. Cigna, 822%. 441%. Humana, 490%. They need to up their game. MOLINA, whoever they are, 859%. SENTENE, 604%. Aetna, 595% since the passage of this bill. We are not, as Republicans, going to continue what you've created, a windfall for healthcare insurance companies, inflationary mechanisms in healthcare without an end. We're going to stop and fix what you created in 2010, which is an out-of-control, inflationary approach to healthcare that rewards insurance companies over anybody else. You told a big lie to the American people when you passed this bill. Their premiums would go down by $2,500 per family. They've gone up by 100%. We're going to stop the madness. We're going to come out with a proposal that will have a different outcome than this. We're going to come out with a proposal that will allow this money to go to people to make better choices for them, to create competition that doesn't exist, and the big loser will be the insurance companies. The big winner will be the consumer. And President Trump stands ready to work with you on the other side to get an outcome we can all live with. We cannot live with this, folks. We cannot live with Obamacare and these subsidies as designed, because they're creating runaway inflation in health care. They're rewarding the biggest healthcare companies in the country to the expense of the taxpayer. We're going to break this cycle. Now, how long will that take? I don't know. But I know this: I'm not going to be forced to continue this wasteful, inefficient program called Obamacare, and because you tell me I have to open the government. I will not. And we'll have an election one of these days, and we'll see how this plays out over time. We'll see what the American people want. Do they want to continue throwing money at insurance companies like this with increased costs to the taxpayer and people that participate in this program? Or would they like something new and different that would break the endless reward to healthcare companies and start rewarding consumers to get better outcomes and lowering their premiums? We'll have a debate about that one day. We'll have an election probably over that. But what we're not going to do is be held hostage for you to get your way, for me to vote to authorize a program that is failing, that was a lie, and I'm going to do what I can to fix this. And if you want to continue to shut down the government, holding me and others hostages to continue this garbage, we're not going to do it. We'll be rewarding the worst possible behavior in politics. You'll just get more of this. So here's my advice to my Democratic colleagues. Work with people who are trying to find a way forward, to reopen the government, to have a conversation about how to better to deliver affordable health care, working in a bipartisan manner, and we'll get to where we need to go as a country. We will not give in to political terrorism and hostage-taking. Your desire to keep the government shut down is terrorizing Americans. Americans are losing vital services. Their lives have been turned upside down because you care more about continuing a terrible program than you do them. And we're not going to give in. I promise you, I will work with you to get a better outcome. I promise you, I will vote no to your political hostage-taking and let the chips fall where they may. You're overplaying your hand. You're doing a lot of damage to good people that just want a better life and some certainty in their life. I try to work with you when I can on the other side. Sometimes we argue, and I try to argue effectively, but I will not be part of this process any longer. You're destroying the lives of Americans for a political desire that's unreasonable. You're asking me and others to continue a program that is fundamentally broken, that's inflationary, and the only winner of Obamacare are the largest health care companies in America who are making excessive profits off a health care system you designed, and all you want is more people signed up on this program, and you're rewarding insurance companies for finding more people who are making a fortune, and the delivery of health care is costing more, and the quality is going down. We're not going to do this. We're not going to give in to this. So my approach is a nightmare for the health care insurance companies. Our approach will be the biggest loser will be healthcare insurance companies. The biggest winner will be consumers who will have choices they don't today and money they can have that they don't have today to buy a better product. That's what this is about. The insistence of the Democratic Party to excessively reward healthcare insurance companies who are doing their bidding to sign up people on government health care that's inefficient, it's not working. You don't care it's inefficient, not working. You just want more people, and you're using the insurance companies in the healthcare space as your agents, as your proxies, and they're willingly doing your bidding. To the insurance companies and the healthcare space, your days are numbered when it comes to this crap. To my Democratic colleagues, you want to debate on healthcare? Let it begin right now. Look what you're doing with taxpayer dollars. You're not relieving the cost of health care to working people. You're increasing their premiums. You're making health care more inflationary, and the only people that really are winning big are health care insurance companies who are willingly playing this game, and they'll never stop. Why would they? Why would a health care insurance company turn their back on this program when they're making a killing? Well, I don't know what's going to happen or when it's going to happen, but I know this. I will never vote to continue this madness. If you're insisting that I have to continue this program, I will not. I owe it to the people of South Carolina and the country to break this cycle. We owe it to the people of America to open up our government and have a logical discussion about making health care more affordable and breaking the cycle of runaway inflation. You're on a course that's going to disrupt American people's lives to get an outcome that's terrible for the country, which is continuing Obamacare the way it's constructed. You will not be successful. I will make sure there are enough Republicans over here to say no to your plan to hold us hostage and continue to terrorize this country. You've gone too far. If I were you, Senator Schumer, I would rethink. Because I'm telling you, every day is not getting better for you. Because every day is getting worse for the people of this country who interact with the government, who travel, who are working and not getting paid. It's getting worse for them. And you're demanding of something of me and others we will not give into. We will not be held hostage to continue Obamacare that's been a miserable failure. We will not be held hostage to continue to give money to healthcare companies, insurance companies, to enrich them at the expense of the American people. So I don't know when it ends and how it ends, but I know what the outcome will be with my vote. We're going to break the cycle of rewarding healthcare insurance companies at the expense of the consumer. We're going to stop this madness with my vote. I hope we can find a way forward, but that way forward will not include what's going on today. So I will be voting no to the idea that we will continue these subsidies, rewarding healthcare insurance companies insane amounts, driving up premium cost, and getting bad outcomes to open up the government. I reject that, and I will vote no to that. And the demands you're making grow every day. You're overplaying your hand, and you're hurting people. Stop it. With that, I yield.